what causes tailbone pain in men? Well, it doesn't matter if you're a male or a female. Tailbone is right here. This is the back of your pelvis, and you can see all these ligaments, and a lot of ligaments are connected to the tailbone. A lot of times there is instability in the pelvis, in the bones of the pelvis itself. There is instability in the structures above, and there is instability in the lower extremities being attached to the pelvis that makes the pelvis not be neutral and relaxed enough. Any deviation from ideal will impact how these ligaments behave, and because these ligaments are connected to your tailbone, any deviation, this is like a tip of a TP. In order to have a tent, you got to pitch a tent, you got to have an apex, a tip to it, and that is your tailbone. So it really is being at the mercy of any balances or imbalances happening on the things that are attached to it. Many times people sit on their on their tailbone instead of sitting on their sit bone. So there is that impact. And then frankly, a lot of people that sit quite a bit. So what's the cause of it? It can be your lifestyle. It can be of too much sitting. It can be a lifestyle of wrong exercises that you're doing because you have dysfunctional patterns of movement, and you take that body to a gym and now you're trying to do your workouts, and that puts undue stress on the ligaments here and the health of your tailbone. The fix is understanding where the dysfunction happens, what function looks like, what your version looks like, and how to make that correction. You can go to a provider for the pain to go away, but since you don't know what caused the problem or how to prevent the cause from impacting your body, you will have this issue coming back with a different presentation. So unless you invest in learning how to be, the solution is not going to be as easy as you realize. In my opinion, when it comes to the world of rehab, us rehab clinicians should really take the time to explain things as if we're talking to a colleague, to educate this new person who is shadowing us in the clinic, trying to be our apprentices, looking at the patient's issue as a project. Unless that happens, you're always left in the dark, hoping the problem's not going to go away, or hoping that what you're doing is not going to feed the problem. We can always hope, but it's always nice to know. So I hope that you've subscribed to the channel. If you have not, please make sure you do so. If you have any questions, put it in the comment. Make sure you share it with your loved ones. And if you have an issue and you need help, contact me using one of the methods of contact in the description box. Until next time, take care.